Hi, welcome back. My name is Tony Song and I'm the Diabetes CEO. And I got a question for you. Have you ever gotten a situation where you test your blood and that number just doesn't make any sense? That number seems a bit higher than normal and you just wonder why that happened, right? Well, I'm going to give you one scenario in which that could happen. So stay tuned. So let me give you this story. So we had a patient that said that they tested their blood sugar and all of a sudden they got a number that was really high and it was up in the 200s and they never are in the 200s. And so they were asking us, well, what happened there? I didn't do anything different. I didn't eat anything that had a lot of carbohydrates, but yet my blood sugar was really high. And so we started to investigate. And what we found out, which is very interesting, and I think this happens to a lot of people that are testing their blood sugar, right? We found out that that person was eating an orange, right? And so they were eating the orange and some of the juice got on their finger. And that's what they tested. And so they didn't test their blood per se, but they tested the orange juice. And that's what gave the weird reading. And so how do you resolve that, right? Pretty simple. We have to make sure that our hands are clean. So soap and water, just make sure that your hands are clean when you're giving yourself your test, because anything on your finger that you're testing around could affect the reading. So in his case, it was orange juice, but let's say it could be any type of syrup. Let's say you had coffee and you put some type of creamer in there that was flavored and some of it got on your finger and you tested that, it'll test that syrup, right? And so you want to make sure that when you have a test that your hands are clean. Soap and water is great. Alcohol swabs, if you have those around, those are pretty convenient as well. But bottom line, make sure that your hands are clean when you test your blood sugar. That's going to alleviate a lot of the confusion of some of the weird numbers that might be coming up, not because your blood sugar is high, but of course that you're testing food particles on your finger. So if that made sense to you, and if you like this video, please give it a thumbs up. That tells me that this video was valuable to you and that you want more of this kind of thing. Also, just want to always make sure that you know that in order for us that have diabetes to prevent and slow down any complications going forward in our future, the number one way to do that is really to be your own expert in your own diabetes. And what I mean by that is you know exactly where your blood sugars are all the time. And this is one of the tools to use, right? So that you know where your blood sugars are all the time. You're a better expert than your doctor, your specialist, even your diabetes educators, right? If you can get to that point, and I know you can, then complications of diabetes are going to be so low in your future. And that's what we're all hoping everyone watching this gets to that. Become your own expert. Become your number one expert in your diabetes. And I know you can do it. I'll catch you next time. Have a great day.